Hi, everyone. My name is Dr. Doris Leung. I'm a veterinary epidemiologist and communications lead for the Canadian Animal Health Surveillance System, otherwise known as CAHSS. My presentation today will be on web-based resources to advance animal health and surveillance in Canada and beyond. So following this presentation, myself, as well as Dr. Kate Todd from the National Farmed Animal Health and Welfare Council, will be present for the Q&A session in case participants have any questions or feedback. So before I dive into online resources and tools that could be helpful to those who are vets, researchers, or those who are in academia, I wanted to discuss the importance of animal health surveillance. So animal health surveillance is ongoing day-to-day work of bringing together information needed to demonstrate the health of animal populations and to quickly detect and respond to disease events. A coordinated and connected Canadian animal health surveillance system is essential to detecting serious threats to animal and public health, such as emerging diseases, understanding endemic disease impacts, evaluating the success of interventions to control disease, and protecting the livelihoods of our Canadian farmers and other animal health and food production workers. So the Canadian Animal Health Surveillance System, also known as CAHSS, has been a division of the National Farmed Animal Health and Welfare Council since 2019. So CAHSS's work is to support effective, responsive, and integrated animal health surveillance in Canada. So CAHSS is focused on the generation, exchange, and application of data-driven information to track animal health and to rapidly detect and respond to changing patterns of disease. So CAHSS it really supports a collaborative network structure and purposefully brings together stakeholders into networks to discuss animal health, identify surveillance initiatives and priorities, and plan surveillance activities across Canada. So currently we have 7 species-specific networks, which include beef, dairy, equine, finfish, poultry, smallholders, and small ruminant species-specific networks, as well as 2 of our special topics networks, which includes AMU and AMR, which is antimicrobial use, antimicrobial resistance network, as well as our vector-borne disease network. CAHSS also supports the work of the Canadian Swine Health Information Network, also known as CSHIN, which is Canada's first national species-focused animal health network. So we currently have 345 active members of CAHSS, with a majority from Canada and the remainder in the US. So CAHSS's network includes representation from farmed animal and agri-food industry organizations, federal, provincial, and territorial government, animal health laboratories, public health laboratories, universities, and many more. In addition, CAHSS works with regional animal health networks across Canada. And so these surveillance networks include the Atlantic Canadian Animal Health Network, ATCAN for the Atlantic provinces. In the Eastern provinces, we have RISO in Quebec, Ontario Animal Health Network, OWAN in Ontario, and the Western Canadian Animal Health Network, WECAN for the Western provinces. So CAHSS works with each regional network to advance common priorities. Now, how does CAHSS fit in with the picture, the national animal health surveillance picture, as well as web-based resources? So we recognize that the internet is known as information superhighway, and that most of us go on the internet to obtain information quickly rather than looking up information in a textbook. So we've really shifted in our way of gathering, processing, and exchanging information. The internet allows us the opportunity to have web-based online resources and tools that allow animal health professionals in both the public and private sector, such as vets and laboratorians, as well as academic researchers, producers, as well as veterinary and agricultural students from across Canada, as well as the US, to be able to communicate, educate, and do research and act on animal health surveillance information in real time. So I'll be sharing a few of CAHSS's web-based resources with you, and really it would be really interesting to have your feedback and have you share your ideas on other effective web resources, or if you have any comments after on web resources that could be helpful for animal health surveillance. So in January 2021, we launched our new website at www.cahss.ca. And so really this website acts as a centralized hub of information with lots of different tools and resources that are useful for vets, producers, laboratorians, and other partners that work in animal health. So these web-based resources through the central information hub really allow different partners to get access to information and to share information quickly and efficiently on animal health and surveillance topics in Canada. So CAHSS tools are available in both English and French on our website, and this includes the resource library, our library that contains documents and media files that are relevant to animal health and surveillance and can be filterable by disease agent, organization, type of media, and more. Our surveillance initiatives library, our inventory of active and up-to-date animal health surveillance initiatives across Canada. So as you can see here, you can see our COVID-19 and cat study with the BC Centre for Disease Control. We have our disease alerts page. So this page generates real-time notification of a disease outbreak that allows for early and quick intervention and action if needed. And lastly, we have our regulated disease table. So this table is designed to allow a user to quickly determine whether a disease of interest is regulated, so whether it's reportable or notifiable nationally and within different provinces and territories within Canada. So since the launch of our website and these CAHSS tools, we've had close to 43,000 page views as of October of 2021, with most visitors from Canada and the US, and the remainder from the UK and Australia. The pages most users frequently land on are our equine network page, our AMU AMR page, disease alerts, as well as a resource library. So within each network page, there's actually quite a few different resources related with a specific topic or species that users may find practical and helpful. For instance, in our equine network page, we've gone through an iterative process, and with dedicated efforts from our network members, we created an equine stakeholder map that provides a visual of the interconnectedness of stakeholders related to equine health and surveillance in Canada. And this includes our industry and veterinary organizations, academia, laboratories, government, as well as our surveillance networks. I also wanted to mention that there's 2 additional tools within this page. And so the first one is our equine disease dashboard created by the CFIA, which is a Canadian Food Inspection Agency. So the purpose of this dashboard is to share public information on different types of diseases such as EEE, which is Eastern Equine Encephalitis, EIA, which is Equine Infectious Anemia, or West Nile virus in Canada. So options are provided to display data by individual disease, location, date, or time period. The other tool we have is a direct link to the EDCC, which is the Equine Disease Communication Center. So this is a great resource that many of you may already be aware of. So this organization is independent of CAHSS and has for many years provided useful information about cases of equine infectious disease in the US and includes several Canadian reports. So the second most popular network page on our CAHSS website is intended for users interested in antimicrobial use and resistance in Canada. So far, we've created a new background document that describes AMU reporting terminology in user-friendly language, as well as an AMU reporting tool that partners can use to help them develop or strengthen their own antimicrobial use reporting plan. So these documents are housed on our network page, and they'll help stakeholders effectively communicate and guide antimicrobial use across different sectors. So we really hope to continue to share and develop more web-based resources and tools on our website to help support member and partner needs, and to encourage our members to submit their own resources, disease alerts, as well as surveillance initiatives that are not already posted on our website. When this happens, these are then validated by CAHSS staff prior to posting on our website, and then are made available in both English and French. So in addition to the tools and resources I've mentioned, We've also been producing an online podcast called Animal Health Insights. So this podcast introduces our listeners to the people and organizations that work to support animal health in Canada. So a podcast is essentially a recording or interview that's posted online, similar to a radio show, but available for access at any time. So each of our podcasts is around 30 minutes long. So some may be a bit longer or shorter depending on the topic and the number of people being interviewed. If there's more than one interviewee, the discussions tend to be a bit longer. And in these cases, we have sometimes split the interviews into two separate episodes. So it's generally recommended that podcasts are between 20 to 30 minutes in length based on the average listener's attention span. So the themes of our CAHSS podcasts range from concerns about the importation of dogs and foreign animal disease, such as leishmania with rescue dogs, to the importance of integrating a One Health approach to veterinary and human medicine, to interviewees discussing having good biosecurity on farm to prevent diseases from entering into a turkey or dairy barn. So our interviewees consist of veterinary researchers, animal health surveillance, veterinarians, federal and provincial veterinarians, physicians, as well as laboratorians. We aim to include producers for future episodes as well. So whenever possible, we produce podcasts in both official languages of Canada, which is French and English. And once episodes are posted, they're distributed via other websites, such as Google or Spotify. So they're more searchable on the internet and can reach a broader audience. So we currently have 10 episodes for download for live streaming on our website and have had over 300 podcast episode downloads from our listeners in North America and around the world. So for more information on our current CAHSS initiatives, to try out our web-based resources, or to share ideas that might strengthen CAHSS, you can visit us at www.cahss.ca, that's CAHSS.ca, or you can email us at cassinfo@ahwcouncil.ca. Lastly, I wanted to mention that funding for our CAHSS activities has been provided through the Agri-Assurance Program under the Canadian Agricultural Partnership, which is a federal, provincial, and territorial initiative. And that concludes my presentation. Thank you for listening in. I'd love to hear your feedback on our CAHSS web-based tools and resources, or whether you have any other ideas on increasing engagement or ways to increase listenership with our podcast, or whether you'd like to collaborate with us on generating new tools that could be helpful for professionals that work in the areas of animal health and disease surveillance in North America. Thank you.